Good morning and welcome to ACC 19 in New Orleans. My name is Beth Hill and I am a general cardiology fellow at Scripps Clinic in La Jolla, California. And with me today I have Dr. Edouard Daher. He is the director of the cath lab and interventional cardiologist at St. John's Hospital in Detroit, Michigan. And so today, Dr. Daher, I'd like to ask you what brings you to the ACC conference, what most excites you?
Hi Beth, thanks for asking me. I think the ACC is a good place where you meet with fellow members of the American College and network. I think there's not too many meetings that you go to that provide you with that many abilities to connect with other people. And I think one of the important things at a meeting like this is really to get informed about late-breaking trials. And so, for example, for me, getting informed about Apple technology and what it can do for you in the near future, and what IT technology and digital medicine is going to be like. So I think the future is going to have some telemedicine in it, and just going to the expo and exhibit and listening to some of the presentation and Mike Gibson talk about Heartline study, which is in the future monitoring patient, I think is awesome and gives you a great update as to where we are in medicine these days.
Great. And so is there one thing, I think you may have mentioned it already, but is there one thing that you were most excited about and your take-home point from this conference? Would you say the Apple Heart study was the most exciting, or are there things to come as well?
I mean, I think there's a lot of exciting things. As an interventional cardiologist, for us, we go to a lot of different meetings. ACC is a good way to just overall round your overall cardiology knowledge, and I think the IT part of it is really awesome. I think that got me the most excited this year, and I think the Apple Heart study is really encouraging. And then there's another study, Heartline study, that Dr. Gibson talked about, and I think we're all excited because it's going to reach mass population. We're not talking about 1,000, 2,000, we're talking about 500,000 people, 500,000. So I think it's a breakthrough in technology and how we do medicine these days. So I'm very excited about that.
Great. Thanks so much for joining us, Dr. Daher.
Thank you.
Have a good rest of your conference.
Thank you.